I think first of all, it's really so precious to be able to meet with the patient advocates themselves, and connect them with the scientists. So I myself am a clinician, so I sort of see both the research and the clinical side in my day-to-day practice. But many of the scientists are not clinicians and don't get a chance to understand the lived experience of the diseases in the same way. And it's important to frame all our research and our potential therapeutic goals in what is meaningful and important to families. And our patient advocates are the best to deliver that message and make sure that we sort of stay on brand, so to speak, and keep our efforts focused in directions that are important to the families. So I have to say, having worked in this field for 20 years, that there's still a dearth of funding for leukodystrophies relative to other neurologic problems like dementia and stroke, because they're not widely recognized and understood as being relevant to public health. So even though about 1 in 6 to 7,000 babies is born with carrying a gene for leukodystrophies, we don't get the same attention as disorders that are more commonly understood by the lay public, and the funding follows that. So ELA has played a pivotal role, in particular in early phase research, to emphasize the importance of leukodystrophy basic research, that really there's no other organization globally that has done it the same way. So choosing then to focus additionally on a specific leukodystrophy will encourage young researchers who might not currently be affiliated with the field to direct their tools and expertise and understanding to the problem of myelination and myelination recovery in PMD, and so is incredibly important. So, from the perspective of therapeutic opportunities for our hypomyelinating disorders, and in particular PMD, where the disorder is so clearly one almost exclusively of oligodendrocytes, with secondary injury maybe to other cells in the brain, but primarily in its pathogenesis of oligodendrocytes, I really have a lot of enthusiasm. We have so many molecular tools available to us now, be it from antisense, which is currently in trial, to other emerging technologies that are RNA-based. We have expectations we'll be able to repair the defects in oligodendrocytes. And the advantage of an oligodendrocyte exclusive disease is that there's a pool of progenitors that, if you can repair the defect, are there ready to repopulate and reconstruct myelin in the brain in ways that other neurologic problems don't have the same reserve. From the perspective of women who are affected by PLP1 mutations, I think there's a lot of important work to do. In medicine and in science, we always pick the worst problem to start with. So clearly, the difficulties of children and boys affected by PLP1 was the first sort of on the to-do list, because their difficulties are so significant and so severe. But it's important to know that probably women who have mutations in PLP1 are not true carriers, but have more limited symptoms but true disease, and we'll have to define and understand the tools to measure and capture that, and over time understand how we can address those needs as well.